Hi everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and we are with our very lovely patient here today who is really bothered by her Prejowl Sulcus. So she notices that she sleeps on her right side preferentially, and just as a general rule, I do recommend that patients switch sides that they sleep on because it can cause flattening and asymmetry of the face over time. Our bones are still a bit malleable over time, so that can affect it. But it's easy to correct. We can actually correct some of these asymmetries with fillers. And in her case, she notices a little bit more of a dip on the right side of her jowl. She's actually looking not too bad, but it is noticeable. So we're going to fill the Prejowl Sulcus with most likely radius or a hyaluronic acid filler. And then we're also going to fill the temples. If you look at her temple, she's gotten some significant hollowing. And there is normally a fat pad that travels across the temple and down the side of the face. And that has reduced over time. So we're going to try to just bump that out. And as a result, it's actually going to lift even the lower part of her face. So any questions on any of that? Make sense? Okay. All right. Good. So we'll get started. Fillers are fun because it's kind of an immediate improvement. There can, of course, be some bruising because we are using a needle in this case. Sometimes we'll use a cannula if that makes sense. I like to inject the filler a little bit past the hairline in the temples. I think that gives a really nice natural look. So we'll go ahead and get started and hope for as least amount of bruising and bleeding as possible. You doing okay? Mm-hmm. And these temples can just take a lot of filler to fill out. We'll see how she does with one vial initially. And any of the fillers can be used in the area of the temple. Today we're using radius, but we can also use Bellafill if we want something that will last more like 5+ years. We can also use Sculptra, which helps to stimulate your own collagen production. And that's also an excellent filler to use in these areas. Other procedures that could also benefit would be, for example, we can place threads under the skin just to go ahead and lift the jowls up and so on. But today we're working with fillers, and you can already see a really nice improvement in the shape of her temple, just with a little bit of radius. We did one syringe today. Probably you could use a second syringe, but we can do this gradually.
Right.
Okay?
Okay.
Looks so much better. She's not really bleeding at all, so it's going to be awesome. Looking great. I'll have you just hold a little pressure on here.
Okay.
Okay. And we'll go ahead and start working on the jowls. So for the jowls, I'm actually going to inject some of the filler right by the jaw angle here to lift things up. And then we'll add a little bit of filler here and here more superficially. And that looks really nice. You can actually see a really nice improvement. Made that jawline really nice and straight. Looks awesome. Good. And I mean, actually, it's amazing. Like the face looks slimmer, even though we've added volume. So that's one thing people are always afraid about is, oh, I'm going to get fillers. Am I going to look fatter in my face? And actually, it can do the opposite. Radius is a filler that's stimulatory, so it does give some stimulation of collagen. It lasts about like a year to 18 months or so. And usually you'll notice some reduction in the filler by 6 months, and at that point it's a good idea to get a little touch-up filler, okay? Even though it may not be completely gone.
Right.
But it's usually, might be 50% gone by then. Okay. So that's good, I think.
See it?
Yeah, absolutely. Yeah, sorry, I'm just enjoying it all to myself here.
You're just enjoying that. Oh my God. Oh, that looks so good. Other than the little needle marks, but oh yeah.
You can tell, right?
Yes.
Yeah. Yeah, that's just, I'll wipe that off.
Yeah.
There you go.
Oh, that's so good.
Good, I know.
Thank you.
You are so welcome.